Our next guest is Dr. Chase Moffat, a foot and ankle surgeon. We're talking about bunions, how you can treat and recover from those. That's something that a lot of us have on our feet, Shannon.
Yeah, bunions are not uncommon. And when they get to the point where they become painful, they become very dysfunctional. So there's options to treat these bunions, usually in that first toe. Well, always in the first toe for the most part, So we're going to talk about bunions.
All right, Dr. Moffat and Shannon O'Kelly.
Dr. Moffat, welcome to Health Talk. How are you?
I'm doing well. Thanks for having me.
Well, thanks for joining us. I always like to get started. I'm always very interested in kind of what your practice looks like, and then more importantly, your background, your training, and then how come you became interested in being a podiatrist, for example. So talk about Dr. Moffat. Tell us about yourself.
So I grew up in Oregon, actually, the Pacific Northwest, and then I got interested in podiatry. Mainly, I like working with my hands. I like, seeing a problem and trying to find a way to solve that, and luckily, podiatry gives an ample opportunity to be able to have that in my career. So, grew up in Oregon, went to college at BYU, then went down to Arizona for my medical training, and then out to Pennsylvania near Philadelphia area for my surgical residency training, and then ended up back here in the Bellevue area. And I've got a practice where it's just focused on foot and ankle, treating conditions, surgically, non-surgically, anything that hurts down there, the foot and ankle, I'll take care of. And then today we're going to focus a little more on some bunions. So I think something that's very common in this area. We've got a pretty healthy patient population out here in the Bellevue area, but this is a condition that I see commonly, and there's a few innovative ways to be able to treat that.
Yeah. Bunions is one of those terms that we often hear, but I don't know that a lot of people really understand what it means and then when it needs to be corrected. And so let's get into a bunion. Let's get into what is a bunion, how does it occur? Give us kind of the what, when, and how on the bunions, and I'm going to ask you some questions on some stuff. Okay?
Totally. So a bunion, most people when they think of a bunion, it's that bump right by the inside of your big toe joint. Starts to grow out, get larger and larger, and your big toe starts to tilt the other direction. So it's that bump on your foot. Now the medical term for that is hallux valgus. Just where the big toe starts to tilt. And what causes it? It's a myriad of problems. Usually it's multifactorial, but it can be caused by predominantly your genetics, the structure of your foot. If you've got some instability at certain joints. Wear and tear, certainly shoes can contribute to that. The kind of shoes you're wearing, if there's a tight toe box, the amount of activity you're and stress you're putting on your foot, and age. So there's a number of things that can contribute to that, and it starts to become painful. And most people notice, like, hey, there's a bump forming on that by my big toe joint on the inside, and it starts to get bigger and bigger. And a lot of people misunderstand that as, it's just a bump or it's a growth of bone, where it's actually much more complicated than that. It's actually a misalignment of the metatarsal bone, which is in the foot, and where that connects at the big toe. So that it starts to misalign, and the positioning changes, and it forms a corner at that big toe joint, which can get worse and worse and worse until eventually it's causing pain. And that it can cause, structural changes where the second toe starts hopping over the first toe, and it can progress and get worse. Yeah.
This is it's a great explanation. I mean, fantastic job. That toe, that big toe, gets forced over, gets pressed in. It starts leaning towards your little toe, and as that goes on, you develop that bump. These become painful. I mean, people can have significant pain with these, right?
Absolutely, yeah. They can be painful, and there's usually when people start to get these, there's some conservative options we can try, and then surgical options, depending on where you're at on that spectrum, whether it's the early stages or the late stages of a bunion. And it can become more painful. Usually with the conservative things, if I see someone it's just the early stages, sometimes we'll put in them some corrective custom orthotics, recommend, wider supportive shoes. But for some people, it just has progressed to that point where there's no return with the conservative care. It's a progressive deformity that gets worse, and despite what you may see on like those TV ads, there's no splinting or padding or nothing you can do to reverse it besides surgery.
Back with Dr. Chase Moffat and Shannon O'Kelly right after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
More conversation about bunions with Dr. Chase Moffat and Shannon O'Kelly.
Dr. Moffat, again, thank you for taking time out to join us here on Health Talk. We're talking about bunions. And let me ask you a real quick question. You talked about conservative. Maybe sometimes you can correct maybe the mechanics of the foot with an orthotic. Are people that maybe have flat feet or significantly pronate or roll over as they walk a little more prone to get this bunion, just from a mechanical standpoint?
It does. That's one mechanical way that they can form. I think of the foot as like a tripod, and when you've got a flat foot, it's like having one of those legs of the tripod tilting up, and the whole foot rolls out. And then that constant rolling as you go from heel strike to mid stance to toe off, that repetitive nature. If you take 10,000 steps a day, 5,000 of those on your right foot, that's 5,000 times a day that it's going through a subtle stress, and multiply that by 365 days a year and a number of years, and it starts to, get worse and worse and worse. The biomechanics definitely play a large role in how that bunion progresses. And so when we do surgery, we're trying to correct that, the biomechanical changes there.
Let's talk about the surgery, kind of the outcomes, the results, kind of return to activity. Kind of give us the nuts and bolts there, okay?
Depending on the severity of the bunion, the root cause of the bunion, kind of determine what surgery is done. I would say most patients can fit into probably two types of bunion surgeries that I do, one of which is called a lapoplasty, where we correct the alignment of the metatarsal at the base, and we tilt that whole bone that's shifting out, we tilt the whole thing back and fix it into place with some hardware. Another type of surgery that I do that's becoming much more popular is a minimally invasive bunion surgery, where you correct the bump through small little incisions. You basically surgically fracture that metatarsal bone, shift the bump back into alignment, and then fix it in place with some screws through small little incisions. Now, the benefit of that is that you've got less swelling postoperatively. You maintain the range of motion at that big toe joint, because you're not, with the minimally invasive surgery, we're not making an incision. There's less scar tissue forming, and it allows for that deformity to be corrected with less dissection. And ultimately, what I have found is less pain as well. There are some patients that are candidates for one type of surgery, and some patients that are candidates for the other. It just depends on a number of factors like smoking history, age, the strength of your bone, the degree of the bunion deformity, and then the recovery kind of varies as well. But I'd say, if we're talking about the minimally invasive bunion surgery, most patients are walking out of the surgery center in a little surgical shoe or a surgical boot. We have just a few stitches we take out about 10 days later after surgery, and then they're back into some sneakers after about a month. Often I will send a patient to physical therapy as well, depending on the surgery and the patient and the amount of, if they've got stiffness or they need some work on getting that big toe moving. Some patients like it just for that sense of, okay, I'm going to have somebody help train me, because that joint is now moving in a corrected alignment that it hadn't been in for years. So sometimes the physical therapy helps to keep that optimized.
That's awesome. Dr. Moffat, boy, great information on bunions. Thank you so much for joining us in Health Talk.
Yeah, thank you.
You've been hearing Dr. Chase Moffat, foot and ankle surgeon with foot and ankle specialist of Puget Sound, footandankleclinics.com if you'd like to get more information. Shannon, I imagine some people come in that are recovering from perhaps the removal of a bunion that you guys are helping out at IRG.
Yeah, we see this post-operatively. A lot of times what you're doing is you're kind of controlling the pain and swelling, but your foot is so important, Tom. The big toe or the great toe or the first toe is really important in gait, and you got to get that toe returned to function so you can roll over and push off in a normal gait cycle.